everyone. My name is Kinga Karake.
My name is Tara Socher.
And my name is Kelly Flurry, and we will be presenting a clinical scenario based on respiratory distress that we have prepared for our students who will be checked off on clinical next week. And Tara Socher will set up the scenario.
Okay, so here's the scenario. Wallace Peterson is a 69-year-old Caucasian man with a history of chronic obstructive pulmonary disease. He was admitted with pneumonia. He's had a very long night, difficulty breathing. He's now exhausted. The scenario begins at 8 a.m. on Wednesday. During the scenario, Mr. Peterson experiences acute respiratory failure. He becomes increasingly confused, anxious, and belligerent as his oxygen levels continue to decrease. The only intervention that will stabilize him is the application of 100% oxygen via a non-rebreather face mask. He will require a transfer to the intensive care unit for ventilatory support.
And we will begin the video.
I'm feeling a little short of breath.
Okay, well, I'm going to raise the head of this bed up for you, but first let me check your arm in. I'm going to come over here and wash my hands. Alright?
I'm going to go ahead and get your vital signs. My name's Courtney. I'm going to be one of your nurses today.
Can you give me your name and date of birth, please?
Yes, my name is Wallace. My birthday is June 6th.
Okay, great. And then we're going to
I'm 40 years old.
Great, thank you. I'm going to raise that bed up.
So what are we trying to do for today, man?
Right now, we're going to start with his vitals and see how he's doing. And have you had any complaints lately?
He's just, I don't know, he's doing, I'm not a nurse, I don't know what to think about anything.
Okay, well let me listen to his heart and his lungs, and then maybe I can tell you what I know from there, okay?
Okay.
I'm going to get your temperature real quick. Can you lift your tongue up for me?
There's the monitor over there.
Oh, okay.
His heart rate is up. Can you breathe in for me? Can you breathe out? Breathe in, breathe out.
Will this tell me the temperature? What was your temperature?
The temperature is 100.2.
Okay.
Alright. You having trouble?
Her
Yes.
is 84. So, what is the oxygen on? Go ahead and titrate it up to 4 liters.
Why is he breathing like that?
I'm so tired. I've been breathing hard all night.
Okay, did you get your ibuprofen yesterday?
We've had any nurses do it.
I want out of this hotel.
Oh, I'm so sorry.
Why is he talking like that?
Confused from
This oxygen isn't helping.
Was it O2 stat?
86.
Okay, we're going to get his O2 stat up. That might be why he's having trouble breathing. And
Matthew, I need you to take this tube off. I can't. It's making my
One
nose
second.
dry.
Nurse, can we take this tube off? So
It's
he
No,
making my
one
nose
second.
dry. I can't
First, we're
breathe.
going to give him acetaminophen, right?
Yes.
Alright.
No, he didn't have it. He was 100. 101.
He's
Okay.
complaining wanting this off, so we need
Yeah,
to
but
do.
Matthew, will you just pull it off of me? I just
Can I
can't.
pull it
No,
off?
just leave it on real quick. I'm about to call the doctor, okay?
Okay.
Oh, my nose is hurting.
Okay, what's the
Well,
name?
we need to do something.
Ring, ring.
Can I get out of this hotel?
Ring, ring.
Yes, Dr. Scott.
Okay, the oxygen level is 84 on 4 liters.
Yes.
He told me to call you if you can't get it. If we can't get it above 88 on 4 liters.
Okay, I need you to titrate his oxygen to keep his sats above 95%.
Above 95. Okay.
Wait, I'm sorry. What's his medical history? Tell me what kind of patient this is.
COPD.
Study back here.
It has.
When did he come in? Which patient is this? I have like I have about 30 patients in the hospital. Can you tell me which one this is?
This is Mr. Wallace. He's a 69-year-old male, comes in with a COPD exacerbation, and he has pneumonia also.
Okay. What else about him? What's his vital signs?
His blood pressure is 130/80. His pulse is 125. His O2 is 86 right now.
And it's on 4 liters?
It's on 4 liters, yes.
Okay. What was his O2 sat yesterday?
His O2 sat yesterday was about 92.
On how much oxygen?
4? I don't know. How much oxygen?
How much oxygen were we on yesterday on a 92 oxygen saturation?
That was 92.
Nurse, he's still.
Matthew, can you get this tube off me? My nose is hurting.
Nurse, I know you told me not to take it off, but he's not.
If you take it off, he's not going to be getting any oxygen, and he's not going to be able to breathe at all. So
That sounds like it needs to stay.
we're going to leave it on, and then I'm calling the doctor to figure out what to do.
What is the brand name?
Wallace, are you okay?
No, I want out of this
I
hotel.
want the brand name.
He wasn't like this yesterday.
He doesn't have an IV.
Yes, is this Nurse Courtney?
This is.
Can you just call me back whenever you have information?
Sure thing.
This is
Wallace, how you feeling?
I can't breathe.
Heart medication first.
Nurse, he still can't breathe.
I just really want out of this hotel.
And he's still talking weird.
Okay.
I really want out of this hotel. I can't breathe.
How many liters is he on yesterday?
Does he have anything other than nasal cannula? Something pretty good? He's still hypoxic.
What is it, doctor?
Nurse, he's beeping over here. I don't think that's good.
This is not bigger than this people.
How much do you have more right now?
4 liters.
Did they say to go up on that? What did the doctor say?
Titrate.
You gonna be alright, Wallace?
Titrated up.
The order said only titrate up to 4 liters.
Then what did the doctor tell you to do to call him back?
Know what liters, how many he was on yesterday.
What was that?
I'm not starting my IV.
Okay, go for that. Here's this. And then
There's no tubing.
Nurse, his stuff over here is getting a little bit louder. We need to do something. Wallace, can you hear me?
No,
it was 2 liters yesterday for 90. How much?
I don't know what's going on.
Ring.
It was not 80.
Yes.
He was on 2 liters yesterday.
Okay, I'm sorry. Who am I speaking
This
with?
is Courtney, nurse, Mr. Wallace.
Okay. All right. So, did you titrate his oxygen?
Up to 4.
Okay. I want you to titrate to keep his O2 sats greater than 92%.
Okay.
What's his O2 sat right now?
74.
Why is it 74? Why haven't you titrated the O2?
I was trying to call you.
No.
Okay.
Oh my gosh. Now we're going to have to code the patient thing. Titrate his O2.
Okay. 5.
No. What did the doctor say? Anybody heard from the doctor?
Alright.
What are you putting on him now?
Right now, it's the
I don't want this mask on. I'm suffocating.
Well, this is going to help you breathe. I know you're irritated.
I'm suffocating.
No, I don't think he's supposed to be suffocating if he needs to be on oxygen.
He needs something quick.
Nurse,
Do you know what that's
I don't know.
Yeah.
why is he suffocating?
Right now, he's just having a lot of trouble getting air in right now, so this is probably going to help him.
Okay. What is this you're doing now?
The device he had only gave a certain amount of oxygen, and this is going to give a little bit more.
So what would that do?
You just go straight to here. Alright. Oxygen going up how much? What's it on now?
It was on 4.
It's on 4. How do you know what this is?
It doesn't.
Okay, right now it's going up to 5 liters.
Is it working?
Let's
I
see.
need my Andrew badge.
Nurse, are you gonna be okay?
We're just checking right now. Take some deep breaths for me, please. How are you doing? Are you doing okay? Can you talk to me?
He said he's suffocating, nurse. He wants the mask. He said he wants the mask off. He doesn't like it.
That works. Okay.
Hey, if our O2 is still going down,
Put that up to the oxygen,
for
please.
that mask.
10?
Yeah.
Okay, titrating up to 10.
I'm starting and boo.
Okay.
Put the mask back on. You can titrate it up.
Wait.
Lane, what are you doing there?
This is helping her get oxygen because he's not getting any.
Have y'all given him the Acute?
It's like just a 12.
Is he getting any better, nurse?
A little bit. You need to listen to this. Did you listen to his lung sounds already?
Yeah, it was just crackles.
Yeah, y'all have a bureau over here as well.
We don't have an order for that yet.
But he needs something now.
Okay. Hello, doctor.
Dr. Scott.
Hi, I'm with Mr. Walsh right now, and his.
Yeah, I'm sorry, what was your name?
I'm Emily. Fleming.
Yes?
Okay, and his oxygen's still been pretty low right now. We have him on an ambu bag. Is there any way we can use this albuterol?
How much oxygen do you have him on?
It was on 10 and it wasn't getting much better. So
10
right
of
now,
what?
liters on a simple face mask.
No. Simple face mask delivers oxygen in a percent. So how much percent of oxygen are you administering the patient?
20 times.
Liters.
20 plus how many liters?
10
liters.
times 4.
60.
60 liters. 60%.
And what does this mask look like?
It is green with a blue nose piece and 2 open holes. Not revealing it.
Most blue pieces are for nebulizers. Are you sure you don't have the patient on a nebulizer mask?
Nope, I'll fix that right now.
Okay.
Yeah, put him on this one.
Nurse, why does the monitor still beeping?
Alright, swap rooms.
Hi, I hope that you found this video a great learning experience, as you will be responsible as students to be checked off next week during clinical. We will provide a scenario similar to this in the simulation lab. As you prepare for your check-offs next week, make sure that you keep these in the back of your head. I've got a few questions that you need to review. Would you have done anything differently at any time during the video? And I think we presented a great scenario that showed negative reactions or negative aspects that you would not do as a student nurse. But then there were some very positive reactions that you would do as a nurse. How would you see the role of the nurse regarding collaborative communication? Collaborative communication is very important. Again, you saw in the video several communications with the doctor, with the patient, Mr. Wallace, as well as Mr. Wallace's brother, who was a visitor in there with Mr. Wallace. You saw a good reaction. The student nurse answered questions, and then again, the student nurse in some of the video ignored the patient as well as Mr. Wallace's brother. The other thing I would like for you to keep in mind is, did the nurse manage the priorities first? So you want to make sure you prioritize. You want to be familiar with respiratory assessment and how you're going to handle a patient in respiratory distress. Also, make sure you review the several ways we distribute oxygen, by mask, by cannula, and know the difference between a nebulized albuterol treatment versus the mask and the flaps that you would open or close, whether or not you were giving enough oxygen or not enough oxygen, or the patient needed more versus less. So those are the things that you need to keep in mind when coming to clinical next week.
Do not forget to review the expert concept care map as this will help with communicate skill.
And thank you again, and we will see you in clinical checkoffs simulation next week.
Yeah, see you next week.